the one organ that really is there just for sexual pleasure. That's it. There is no other function of the clitoris. So this study was looking, it's a small study, but it's looking at blood flow of the clitoris and does it improve with hormones? Or does it improve if you're not using hormonal treatment in the area of the clitoris? And that was the other significant thing. It wasn't just the fact that it improved blood flow, it improved, therefore, orgasmic strength and drive, all those systemic things that you basically are going to see with testosterone. Welcome to RevMD Podcasts with me, your host, Dr. Debra Durst, and...
Hey guys, Farideh Golembieski, family nurse practitioner here at Revitalize MD.
So if you are new to the channel, then we appreciate you watching and hope that you enjoy the content we're putting out. And if you are a return viewer, then thank you.
Welcome to another exciting show.
Yeah. Thank you for putting up with us, right? And listening to us. But we're going to talk today. I think it's a great podcast on the clit and how the clit matters.
Absolutely.
It does matter. And so, again, I think this one's for the ladies and the men.
So this podcast is going to focus on a study that focuses on the clit. I mean, like, how many studies can we say just focus on that one organ?
The one organ that really is there just for sexual pleasure. That's it. There is no other function of the clitoris. And it's actually a lot bigger than you think. So there's a lot behind the scenes that is also there. And the tip is just the glands, and the whole clitoris is the equivalent of the penis and the man. So if you just think that's our penis. It's important. It matters. It's important.
It matters.
Right?
Men,
Yeah.
does your penis matter?
Yes. So this is why we're talking about this study in the clitoris, because it has importance. And again, as a woman ages, what are the changes that happen? And so there are changes of decreased orgasmic strength and decreased sensation. And so
Decreased blood flow.
And so this study was looking, it's a small study, but it's looking at blood flow of the clitoris and does it improve with hormones? And so
it's specifically what hormones?
And what hormones? Or does it improve if you're not using hormonal treatment in the area of the clitoris or the female anatomy? So it is used, it's a female sexual dysfunction that we're addressing, and it's a small study with 81 women with female sexual dysfunction. Female sexual dysfunction is a huge spectrum, everywhere from low drive to low arousal, orgasmic strength, maybe even pain with sex and lubrication. So, but this is the entire spectrum it's looking at. And so they did some baseline studies and measures, and then they measured at 6 months. And there were 4 different treatments, right?
Yeah.
There was just that moisturizing, and then they did a topical testosterone, a topical estrogen,
and then a combo.
Right?
So are you guys curious? Did it make a difference? What do you think?
Yes. Well, and again, at the end, if you've had any experience with topical testosterone or estrogen, you let us know. But they actually did do baseline stuff of a physical, and did an exam, but basically labs and an ultrasound, or what is considered Doppler. And what are the results at 6 months? Drum roll. I know. Yes.
So testosterone, increased blood flow.
Correct. And so again,
Significantly.
if it had testosterone in it, then it mattered. So testosterone topically, or testosterone and estrogen, but estrogen alone and lubrication alone did not work. And so and significantly is a key.
Like significantly.
I love it. And it did. So that matters. The clit matters.
Blood
Hormones
flow
matter.
matters.
Blood flow matters.
So to sum it up, testosterone improved clitoral function in therapy.
And the big, I guess, added...
Or with treatment, I should say.
And the big added information here, which is key, is there were no significant side effects. And again, no change in laboratory markers such as cholesterol and diabetic markers. So that is absorbed. That is not just a local treatment, because we actually use those hormones topically for systemic effects in practice on a daily basis.
Meaning they absorb into the bloodstream and then
Correct.
are sustained
Yes.
and affect lab values.
Yeah. And so you can actually use those topicals, and they're absorbed very well in the external vaginal area. Also would be absorbed well internally. Internally is mucosa. Skin, it can be absorbed. Again, testosterone's a little, more difficult to absorb through the skin, but in that external female genitalia, that is basically a transition zone between mucosa and skin. So great absorption with that. We see levels increase all the time. So really, you're talking about across the board. And that was the other significant thing. It wasn't just the fact that it improved blood flow, it improved, therefore, orgasmic strength and drive, all those systemic things that you basically are going to see with testosterone. So
And-
improved sexual function across the board, including drive. So
And no negative adverse effects.
yes, no negative adverse effects. So if you want to see why we get a little, I guess, disenchanted with the medical system and
Oh, I like
how
that
we
word,
treat it.
disenchanted.
Is that a better,
I like
less
that.
heated way for me to say
That
it?
was so sweet of you.
I know, because I can get pretty fired up about some of this. But if we look at the indications in major societies that determine guidelines that are done by experts that actually aren't treating women with hormones on a daily basis, and they talk about testosterone in women, all of those guidelines essentially say, and we're talking about global consensus here, international global consensus. I have done deep dives on all this. We'll get into it more and more, but the consensus is testosterone not in compounded, only in conventional form. So meaning manufacturers, a manufactured brand, or product, which there are none in the US for women, that you can only use conventional topical, which would mean a male topical in some way, because there are approved products for postmenopausal women with only hypoactive sexual desire disorder, which is low drive. But right here, we have a study that says
That can improve
blood flow.
blood flow
Yes.
and orgasmic strength,
And
which then is lubrication, which is
Yes.
then pain with intercourse, which is, it's just the list goes on and on. Blood flow matters.
blood flow matters. The clit matters. And sexual dysfunction in women really matters because it increases your risk of depression, anxiety. It has a huge psychological component,
It affects relationships,
quality of life.
quality of life.
So, and again, there's, lots of stuff all over, the internet and social media about even like workplace accommodations, but we don't want to address the root cause. And so if we have major guidelines being written by societies that are, again, supported by pharmaceutical agent or companies, that the only indication at present without a product for women for testosterone in the US is that you can use a topical male product, topical only is what they're saying, topical for postmenopausal with a low drive or hypoactive sexual desire disorder, where we see right here that the clitoris has positive effects.
Yep.
And that's orgasmic strength.
And then we see the positive effects every day in patients.
We
that
see it
treat,
every day.
of all ages.
Yes. And it is not just topical products. So you really have to know hormones. You have to be able to follow. You need to be able to have communications and informed consent with patients, risks, benefits, and follow them adequately. But you can use other forms of hormone replacement therapies, such as injectable, even if it's for women or like a conventional product used for women. You can also have it compounded, and those are safe avenues. And we've done other videos of that.
You can do
Or
pellets or
pellets.
implants.
Yes.
There's
So,
patches.
Yeah.
I mean, there's a lot out there.
Yeah. So just know that this actually, or this is a small study, but this isn't the first study. There's lots of studies just talking about the fact that there are testosterone, progesterone, and estrogen receptors in GU tissue for women. So, genital urinary tissues for women. So,
And that those tissues improve with treatment.
And logically, it just makes sense. Again, our symptoms start after our hormones decline. And so we have dryness and pain and decreased orgasmic strength and laxity and urinary tract infections and frequency and all the
And just
things.
to kind of put out there, because it's often that I hear women go, oh, I didn't realize I had that much testosterone or that I made testosterone. So we were born with testosterone and estrogen and progesterone. And as those hormones decline, we see the negative side effects of that.
And fact is that testosterone is the most abundant circulating hormone in a woman's body. It's just not the predominant hormone in our body because, again, estrogen and testosterone are present in both men and women. It is much higher, 10 times higher in men than in women, and estrogen is much higher, 10 times higher than in women than in men. So, but they're both present. And they both need addressed, and it is a circulating, abundant hormone in a woman's body that declines with age, like you said. So
the clit matters.
The clit matters. So if you have any comments, and I'm sure that you will, just let us know. So are any women experiencing a decreased, orgasmic strength or sensation? And as they get older, and men, do you have a woman and you feel like that your significant other is having more difficulty and you're thinking it's your problem? Because this
That's
would
what
indicate
happens.
there's some changes that happen that both men and women need to hear about and know that there's some solutions out there. And we talk about those in other videos. So
Absolutely. So if you've used topical testosterone, let us know your experience. Let us know how it's benefited you or if you've had any issues. We always want to hear it.
We want to hear all the things, and then we are willing to deep dive into anything wellness or sexual wellness. So thank you for listening.